Hi everyone, this video is going to explain what growth plate injuries are and the different types. Any break that involves the growth plate is called a Salter-Harris fracture. These occur in the long bones, like the ones in your arms, legs, fingers and toes. There are 5 different types that increase in how bad they are, depending on whether they go through the bone head, the growth plate, the bone neck or all of these. These are some of the most common fractures in kids, especially in those assigned male at birth, as their growth plates close later. If not treated, they can affect the bone's ability to grow permanently, but that's what we're here to avoid. Type 1. The symptoms are often pain, tenderness and swelling around the growth plate, and it often isn't seen on x-rays, so doctors rely on the physical exam of the bone. This is the mildest type of break. As you can see here, it goes straight across the growth plate, so it's unlikely to affect growth in the future. It heals quickly and is unlikely to have any complications. Type 2. This is the most common type of break. As you can see, it starts off like a type 1, cutting across the growth plate, but it ends up going through the bone neck as well. It can cause a visible deformity in the limb. Like type 1, it's often easy to reduce, heals quickly, and can be treated by putting the bone back into place and securing it with a splint, sling, or cast, which means no surgery. Yay! Type 3. This is more common in older kids as their growth plates have started to close. It cuts across the growth plate like types 1 and 2, but goes through the bone head as well. If there's a gap created by the break, called a displaced fracture, then surgery is needed to realign the bone and fix it in the right place. The symptoms often include pain, swelling, and joint instability. These breaks usually occur in the bones at the bottom of the leg or in the finger. Type 4. This is quite a rare and severe fracture. The symptoms often include lots of pain, swelling, and joint deformity. As you can see, it goes through the bone head, growth plate, and bone neck. There's an increased risk of growth problems, so it needs to be seen by an orthopedic doctor urgently, and might need a longer follow-up after surgery to make sure there are no growth issues in the future. Type 5. This is the most severe type of break. It's very rare and hard to see on an x-ray, so it's usually diagnosed a while after the injury, when growth problems begin occurring. As you can see, there's no actual break in the bone, but the growth plate has been compressed or crushed, causing the damage. Now we've spoken about all 5 types of Salter-Harris fracture. You can always go back and watch parts of this video again. That's it for now. Thanks for listening.